Welcome back. I heard a little echo there, I guess, in the bumper, and that was good in the first hour. We actually had a little bumper dealing with Foil, the latest song by Weird Al Yankovic. We're now in a wellness hour, and by the way, all of the topics now are open for you to call in for questions. The first thing we're going to talk about is lumen photon therapy. Ron, I want you to tell us some more about this case you mentioned about the lady with post-polio syndrome. Can you tell us all about that? Yeah.
First time we had a chance to deal with somebody who had polio, because polio goes back to the mid-1950s, and then they came up with an injection that could take care of it. First, we had this just as used to be, they give a lollipop or something with it. Dr. Bill, do you remember that? We had or some liquid. Yeah, we had that. And then in this case, this woman had heard about our equipment. She had polio for 40 years and maybe 50 years. I can't remember exactly. It was a long time. And she got our lights, and she called me up and said, can I try this on my legs? And I said, okay, well, try this. Try the muscles. Try to get more circulation. And over the course of a year, she got to where she could walk around in her home. And she said she tried to walk into the church one day, but she said it was just really too crowded, and she wasn't comfortable. But she could walk around in her house and get around comfortably, she said. But she wasn't comfortable going to a mall by a long shot. Church, they finally set up so that she could have an escort that would walk in with her. And that took care of that. And the last I heard, she was still able to do all of those things after, all those years of having that severe atrophy. She was able to do this.
Yeah, and of course there's a ascending Guillain-Barré paralysis where sometimes there's some damage, and you'll get a post-Guillain-Barré paralysis disorder too. We see that sometimes. Post-polio syndrome can hit you 50 years later. And frozen man syndrome, which is a variant of it, where basically your neural pathways start to reduce as you get older. And if you've got reduced neural pathways, you basically get frozen in your body and you can't move very much.
Yeah.
So transcranial pulsed light therapy, lumen photon. In fact, we have a gentleman who has brain cancer. We talked to him and consulted this morning before the show. And I'm going to recommend that he augment his therapy, which he's going to get gene-based therapy, and are taking our cancer nutraceuticals from NutriMeds, with lumen photon and solar pulse. The lumen photon is going to increase circulation, which changes the redox of the tissue, which increases the oxygen uptake, and it's going to help in many different ways.
Yeah, it should. I would certainly expect it to do that.
Yeah. So, can you tell us more about any other cases that have happened?
Cases of just different things? Yeah. Different injuries, that sort of thing?
Yeah.
Well, we first ran across this in the equine world, where we live in North Carolina, is where the U.S. equestrian team had trained for like 50 or 60 years, and we got involved with the horses, and the veterinarians pretty quickly all ordered our equipment because they realized it was more effective than the cold lasers that they had.
Are you on a speakerphone right now, Ron? Ron, are you on a speakerphone?
Yes.
You need to be on a regular phone. If you're on a speakerphone, that's why we're getting an echo.
Oh, I'm on the. Let's see. It's a corded phone.
Yeah, but is the speakerphone where you're speaking into the speaker or your headset?
Okay, I don't have the. Hold on, let me try that just a second.
If you're speaking and you can actually hear the sound counting out because you don't have it against your head like a regular phone, that's why we're getting an echo.
Okay, well.
Yeah, okay. What I'm going to do is I'm going to continue talking about lumen photon therapy. When we give it to people that say they have hepatitis, it's going to help reduce the liver inflammation. It can support energy for stem cells to migrate into the tissue and differentiate. It's amazing for detox, for example, over the heart for heavy metals, stimulating cardiomyocytes to improve mitochondrial function. If you get peripheral neuropathy, like a dysmyelination disorder, for example, from diabetes, or toxic neuropathy, it's going to help tremendously to re-heal those Schwann cell dysmyelinated neuron pathways. How does that sound? Is that better? Yeah, I don't have the echo. I can still hear an echo on my end. So you must still be on speakerphone, right?
Well, it's a regular corded phone.
But is the phone on your head, or are you speaking into a speaker and then the sound comes out of it?
I'm speaking into actually just the old telephone handle.
Oh, okay. So the telephone's by your head, in other words.
Yes.
Oh, okay. So something technically otherwise going on. That's strange. Because when we were on last time, we didn't have this problem. So, Ron, what I'd like you to do is also, when we talk about lumen photon therapy, we're having a lot of people tell us that for pain control, post-op, for pain control, for spinal pain, for, let's say, a thoracic outlet syndrome, carpal tunnel syndrome, basically any kind of chronic non-healing wound. If somebody has plastic surgery, lumen photon therapy is going to improve their plastic repair as well. It's amazing, isn't it?
It's one of those where I keep trying to make headway with the VA, Veterans Administration, because this is one of those, I think if they could buy this and hand this out to the vets who have diabetic neuropathy, I can't imagine if they would use it.
If you use our supplements plus the lumen photon, they're going to 100% will improve. We talk about remission. We don't talk about cure. We talk about remission, which means your painful neuropathy, which 1 in 20 diabetics gives a chronic painful neuropathy. There's no need for it. We can stop glycation with nutraceuticals and lumen photon therapy. Makes an amazing difference. The echo's gone. So, there's really no excuse for this. And, of course, they're conventional doctors. We should be using high-dose Nutritrala, Nutrifos Neurogen, Omega Supreme Krill, Cell Detox Glutathione, Anti-Inflammatory Cell Defense, Cognition Plus, Brain Power, things like our NutriDefense, which has the anhydrous catechin, polyphenol. The Omega Supreme Krill, of course, has the astaxanthin, and the only form of krill that has astaxanthin, every other form does not. So it makes an amazing effect. So we get testimonials from people all the time. It really is quite amazing. If we have people even with things like Asperger's syndrome, using transcranial therapy with Asperger's and our nutraceuticals helps tremendously. People have brain tumors. We tell people you can augment that with whether you're taking B17 vitamin, which is the vitamin you get usually from Mexico. You're doing gene-based therapy, conventional treatment, cancer. You can use transcranial therapy or if you have a brain tumor to tremendously decrease the ability of the tumor to grow and actually help to strip off the fibronectin capsule, allow your immune system to attack it, to downregulate the genes that cause the cancer to occur. So lumen photon therapy is like a universal, what I call health promotional light therapy. So whether you're trying to regenerate cartilage for a joint or to stop a carpal tunnel syndrome or a thoracic outlet, or you have spinal stenosis, and the doctors think, well, I got to do surgery, but what can they do? I mean, most of the time when the doctors do surgery on the spine, unless it's keyhole surgery, their meddling actually makes things worse rather than better, doesn't it?
That's a tough one too. It's a lot of pain if they, as the nerves get impinged in there. So it's
well, they're not really pinched. The thing is, it's often actually increased what's called TNF alpha. I've done tests on people where they've had a nerve conduction ENG, electromyography test, and it only picks up 42% of people that actually have physical or anatomical spinal stenosis where they need a neuroforaminal surgery where they go through the neural foramen or they expand the triangular canal because of spinal canal, where below T12 you're basically a spinal nerve root, you don't have spinal cord anymore. So most of the time when people are told they have spinal stenosis, they have spinal encroachment, but really their main thing is inflammatory molecules in the dural nerve sleeve. And if you downregulate those, a lot of doctors will try transforaminal steroid injections, which, by the way, sometimes helps. But you can't do more than 3 to 6 injections, and you can increase the level of what's called chronic leakage of cerebral spinal fluid. So people need to know these facts. Their doctors may not always tell them, because I've done these. Actually, was training for in Colorado to be a pain specialist with the guys at the Anschutz Center. So you got to know this stuff, or your doctor may lead you down a pathway of stuff you don't want to see happen. Lumen Photon is going to save you a lot. It's just light therapy. Welcome back to the Nutrimedical Report, and we are joined by Emil de Toffel. Emil's here just for one segment today, and we'll be talking to him regularly, talking about the reason why people should start cleaning up the dirty electricity in their home. First step I'd recommend they do is they get if they have a smart meter on their home, is to get a gigahertz solutions. They can actually measure things like electric cooktops, their smart meter, and other things that are electronic radiation sources like microwaves. If you turn on your microwave and put your gigahertz solutions and point it at 6 to 10 feet away and it goes screams, and you have the audio on, you realize it's cooking you too. It's not just cooking your instant dinner or heating up your coffee. It's heating up you. And it's not just a thermal effect, it's non-thermal effect in your DNA, shattering DNA and screwing up cell membranes, and transmembrane scalar signaling of molecules vibrating in solution that signals and turns on and off genes. Next thing I think people should get is a Stetzer meter to measure the transient surges caused by switching mode power supplies, transmit it down your power lines in your home from dimmer switches and from LED lights. And then go and put the Stetzer capacitors on to stop it. Third step is to actually get a oscilloscope magnetometer like I have and walk around your house and actually test it to see where your electropollution is, and then start to either fix the wiring if it's bad wiring, or do an A and B setup with the Stetzer meters on the A side or B side of the power, or remove dimmer switches. And that third step, how simple is it for people to, in a sense, get the magnetometer that can measure frequency of electrical and magnetic fields, which is the toxic effect, and then to display that frequency and determine where the toxic effects are in their home?
Yeah, it is interesting because this dirty electricity, just to remind everybody, is high-frequency signals getting on the wiring of the home. You know, the wiring, of course, can and should be conducting a 60 hertz signal, the power that drives our appliances and our lights and so on. But because of the smart meter and the other things that we have plugged in, fluorescent lights, compact fluorescent lights especially, halogen lights, dimmer switches, yes, the curlicue one. Dimmer switches are terrible also for injecting dirty electricity back into the wiring, these high-frequency signals. And those little transformers that we use to charge our phones and to do other things are also injected.
By the way, you sent me material to wrap those around. So if you find them, for example, let's say your clock, and it's not going to be to move it from the bed to the opposite side of the room, which we often recommend to move away, you can wrap that step-down transformer, whether it's for your computer because it's sitting beside your house, or it's, let's say it's in your bedroom. We tell people if you have a Wi-Fi, turn it off at night. Real simple, do that. You can also use things to block the radiation from coming into your specific areas of your home, like a Wi-Fi blocking a paint or blocking material that can block radiation coming in from, say, a smart meter or a Wi-Fi network, so you can have your bedroom set up so it's kind of electrically neutral. It doesn't have a lot of electropollution in there, and it's got Stetzer plug-ins in the wall, so you protect yourself.
That's absolutely right. There's a variety of shielding materials that are available. This stuff can be stopped, but you need to know what you're dealing with, which is why you and I, we've been hammering away at get a meter and make some measurements. You need to know if you have a problem in your house. You need to know what kind of problem is it. Is it a magnetic field? Is it a dirty electricity problem? Is it a microwave issue? What kind is it? And thirdly, you need to know where is it coming from. Is it coming from the street? In other words, is it coming from the power as it enters your home? Is it coming from your neighbor's ham radio? Is it coming from your own Wi-Fi setup? Where is this stuff coming from so that we can address it specifically?
Right.
You need to have a meter. You need to have a meter as a starting point. Otherwise, you're working totally blind. I would encourage people to visit Dr. Bill's website and check out the link he has to EMF meters. There's a whole variety of meters available there. If you need help, give a call, and the people there can help you pick the right kind for what you're trying to do.
Right.
But
and, of course, we have a link directly to less EMF. And I tell people it's not a minor thing. If you're adding it to the radiotoxins from Fukushima, these electrotoxins, which are immediately around your home, if you're using something like, for example, I received, and I have it here in my studio, these little pockets, and it has a radiation protection shielding. So if you have it in your pocket, your body's not irradiated, but it can still pick up a radio signal or a phone call or anything else, 4G network. But it's not blasting you. And that's what's nice about these technologies. You can shield yourself. So I like those little, I think they're about $18 for the little pockets that we recommend. What are they called?
Yes, the little pouches. We have a variety of different pouches, different sizes, different materials. Some of them are actual pouches that you can put your phone into, and they might be shielded on one side, so the phone can still work, but you're on the shielded side of it.
Yeah, that's one I like. You can have the iron-on patch, too. You can do it inside of say, shorts or something. I like the pocket because then it's more portable. You can put it in your purse or a guy's pockets. Your cell phone, not only is it protected because you can have a little stylus in there, but it's also slim, and it doesn't bulk up and it doesn't radiate your naughty bits.
Correct. And it also protects the phone from bumps and scratches as well. So It's a very handy way to reduce. Some of them can even be used while you're on the call. In other words, they're made of an acoustically transparent material, so the sound can come through. So you can have the phone in there while you put the phone up to your head to make your call. And so you can reduce the radiation to your head during the call, which is when you get the majority of the radiation exposure.
Right. We also tell people if they're going to get an ear jack, they want one with an air tube, and you sell those as well. What about these? The real big push. I found out in Europe that we have European listeners that are on our Dish Network. We have Dish Network, by the way, it's across Britain, all of Europe, North Africa, the Middle East, Russia, China, and other affiliated countries in that area of the world. And in Europe, they've gotten rid of all incandescent bulbs, 100 watt, 60 watt, 40 watt. And now they've got these curlicue lights, which are basically compact fluorescent, or they have LEDs. The compact fluorescent actually boosts the voltage up, and the LED lights drop the voltage down, increase the current flow. These both generate electropollution, don't they? Can you describe it, and how do you pick it up?
It's a transformer built into the bulb, which is changing the voltage either up or down, depending, which injects that dirty electricity, which first of all radiates electropollution out into the immediate environment of the transformer. But also it's injecting that dirty electricity back into the wiring, which then circulates throughout your house and radiates at you from even a different room or from a different floor of your house, because now it's gotten into the wiring.
I talked to...
and it's coming here as well. We're going to be forced to not be able to buy incandescent bulbs pretty soon.
Right, well, George Bush...
They're sold out.
George Bush actually, before he left office 7 years ago, passed an executive order getting rid of all 60-watt bulbs at a certain future date, and I think it's coming up. Europe, they've already done it 3 or 4 years ago. They got rid of 100-watt bulbs. The only manufacturer now for these is in China, and it will be illegal to even import them, which I think is bizarre. So if you get these other kind of LED bulbs, you can get LEDs and actually detoxify the electricity, but you got to use tetzerizers, right?
You do. You've got to get that dirty electricity out of the wiring if you're going to be injecting it.
Don't ever use curlicue because they actually radiate mercury vapor harmonic frequencies. The LEDs are okay if you use Stetzer plugins. So LEDs are okay if you cut the pollution with the Stetzer. Welcome back to the Nutrimedical Report. And, of course, yesterday I updated some of the core protocols for wellness, and we've made it a little bit simpler by saying core to level 4. That means the essential things you need to do to correct things like, for example, hypertension. What is hypertension? Hypertension is spasm of blood vessels and increased viscosity and microcirculation related to lack of nitric oxide and free radical reactions occurring in the blood vessel wall, the endothelia. So the first thing you want to do is take Kardovite, 15 to 30 drops, 3 times a day, 2 to 3 capsules 3 times a day of Kardovite if you take the capsule form. Supernox, 2 to 3 caplets 3 times a day. It increases nitric oxide production. Magnesium taurate and magnesium glycinate, 2 to 3 capsules of each 3 times a day. And Gamma E Plus, 2 soft gels twice a day, and Omega Supreme Krill. If you're going to pick a different one, you can use the Omega Supreme. I like to take at least 2 Omega Supreme and 3 Omega Supreme Krill in the morning and 3 Omega Supreme Krill at night. That's the core. You can also increase nitric oxide if you're using things like LUMEN photon therapy over your heart or blood vessels. If you use proline infrared sauna, and if you do vibrational exercise dramatically increases nitric oxide production, especially in the higher energy, like 50 hertz. Diabetes, diabetoline, 2 capsules, to 3 capsules twice a day. Biotin Plus, 1 capsule twice a day. These replace all the minerals and other factors and act as insulin analogs to decrease insulin resistance. Minerals Plus has the extra vanadium and chromium. Leptin metabolic, and I recommend a higher dose than is on the bottle, 1 capsule twice a day or 2 in the morning, and berberstatin at least 2 capsules twice a day. Diabetes basically is insulin resistance, and I postulated years ago there was what's called an IRP, or insulin-resistant peptide. That peptide's proteroline, so the berberstatin and these other nutraceuticals will increase that. You can also take things to reduce the oxidative stress in diabetes or glycation with carnosine, Nutrimedical, and cell detox glutathione, because glycation is the real common pathway that increases inflammation, cataracts, vascular disease, cancer, etc. Depression, we have a thing called pteridine, which is a new name for our BH4 biopterin. Pteridine basically comes from the butterfly wing because it's a genetically engineered bioidentical form of tetrahydrobiopterin that is the same as the vascular form in your blood vessels and in your brain to correct depression, also vascular disease. Samethyl, acetylindazomethine in one sachet under the tongue in the morning. It's a lemon flavored powder. It's excellent. You want to take little bits of it because it's real powerful. It goes, wow, that's strong. So I usually tell people take like half of the sachet, wait another 5 or 10 minutes, take the other half, and just hold it under the tongue. It goes directly into your central circulation. Calm mind, a scoop 3 to 4 times a day for depression because it's often associated with anxiety. Bio-LVR because B12 and folic acid and B6 deficiencies are tied directly to the problems with the tryptase and pyrrolase enzymes, and then Minerals Plus that contains the extra minerals including orotate form of lithium and other minerals like manganese and molybdenum that are necessary for bioconversion. And of course you should be taking Vitamin Mineral Max or the drinks such as Ageless, Energize, Life Support, etc. in order to support your general nutrition. If you're trying to lose weight, leptin metabolics at the top of the list, 1 to 2 capsules twice a day. Glycemics and Ageless Energize, which has chlorogenic acid. The glycemics will stabilize your blood sugar. It should replace at least 2 meals and 2 snacks a day. Carbo blocker, 2 capsules before all meals and snacks. Lipo flush, which will mobilize your calories. Mitothyroid, because everybody who's overweight has basically thyroid deficiency syndromes, and it may not be full-blown hypothyroidism, but it's a form of hypothyroid activity where you're converting to reverse thyroid hormone instead of the T3. It's called RT3. And if you do a test with your doctors or do an alternative test through, say, Life Extension or one of the labs like Lab Testing Direct, you have to measure properly free reverse T3, RT3, as well as free T3 and free T4. It's impossible to determine if you're hypothyroid unless you measure that also with core body temperature. If your level is converting a lot to the ratio of reverse thyroid hormones high, you're basically functionally hypothyroid. Even if you don't have antithyroid antibodies and your free T4 and free T3 are okay, if your RT3 is high, it'll literally block your metabolism. It literally shuts off the lock and key on the mitochondria. Mitothyroid, a capsule 1 to 2 in the morning. Nutridyne, 10 drops in filtered water twice a day. Vitamin Mineral Max and Minerals Plus. That's for weight loss. Very important to do aerobic exercise, and I recommend the body elastic bands with vibrational platform exercise at least 20 to 30 minutes a day, and then a walking program like a treadmill or a walking program. I like the treadmills because you'll be walking uphill like a grade 2, 3, or 4. It's better to walk uphill all the time. For detoxification, we hear people all the time, how do I detox from radiation and from heavy metals and chemicals? Keelar Max, 2 to 4 capsules twice a day. Ultra liquid zeolite, 13 drops in filtered water 3 times a day. We have the only non-acid wash zeolite in the Western world. NutriDefense, which I designed, has the most powerful antioxidant in the world, the anhydrous catechin polyphenol, which will stop vascular disease, brain damage, kills viruses, both RNA and DNA capsulated viruses, disrupts their viral capsids so that they fall apart. We have xenoestrogen detox for chemicals and Samethyl. The NutriDefense will pull out the toxic chemicals. The Samethyl helps to pull out heavy metals as well, because methylation of metals is a very important pathway to get into bile. Bio-LVR, of course, methylation support with activated form of B6, B12 and folic acid, Nutrimedical and cell detox glutathione, because you have to stop the free radicals, and of course Regenerex. For eye care, we get a lot of time when people request what I need for eyes. I say Can-C eye drops, 1 drop to each eye, at least 4 times a day. Vision Max, 1 capsule twice a day. Nutrimedical, 1 to 2 caplets at least twice a day. I take 2 twice a day. Cognition Plus, a capsule twice a day. Neurogen, 2 soft gels in the morning or twice a day. Cod liver liquid, I make a cod liver liquid. 10 mils in a smoothie, and I make a large smoothie in the morning, so it's all pre-made for a couple of days. Omega Supreme Krill, 2 to 3 capsules twice a day. And of course, I recommend Silver 100 to prevent low-grade infections, including fungi, viruses, bacteria, including things like toxoplasmosis, toxoplasmosis, which is the cat form, or canis, the dog form of toxoplasmosis. And of course, pigeons carry a lot of toxoplasmosis as well. So if you're in an area of the country that has a lot of pigeons, you're at much higher risk of getting into trouble. So that gives you some ideas there in terms of how to approach that. We have, of course, the most powerful nutraceuticals. One of the ones that we want you to understand, we have 2 forms of fat-soluble thiamine. Ultrathiamine B1, which is one of the more advanced forms. We also have another alternative form called the allithiamine. These are extremely important for any brain disorder, eye disorder, peripheral neuropathy, reducing diabetic thiamine deficiency. If somebody has candidiasis or fungi in their gut, they're going to have a thiaminase that destroys thiamine. It's extremely important to compensate. So you need 2 to 3 capsules of ultrathiamine B1 and allithiamine twice a day if on your QRMA test or your functional medicine test it shows you're thiamine deficient. It's very, very common. We have a lot of people with tendonitis, bursitis, and other chronic pain problems. I tell them to take Tendon Mender, Joint Performance, and Collagen Max to start with, add anti-inflammatories, Inflamex, Cell Defense, and of course the Inflamex you can take 3 to 5 capsules twice a day. The Mountain Red Velvet is fantastic. I usually recommend one of the 3. They should open the capsule and put it under their tongue for 10 minutes and absorb the more fragile components. When they supply the body with the building blocks this way with, chronic pain or healing from anything, wounds or surgery, Mountain Red Velvet's just amazing. Even if someone's trying to rebuild their bone marrow if they've had chemotherapy or radiation. We had humanitarian help earlier today. We had a lady that we know with cancer, and one of our components we're going to give her is Ageless, the vanilla form of Ageless with our new upgraded form of the Ageless components, and Mountain Red Velvet to help rebuild her bone marrow. We'll be giving her Allison Med. You can also, to help fight infection, use the Silver 100, which is also a stem cell and bone marrow stimulant. We have technologies like Soma Pulse that increase stem cells in your bone marrow regeneration. You can put it right over the hips, the greater trochanter of the hips and the lower back, and it'll help regenerate your bone marrow too. Back in a moment. Welcome back to the Nutrimedical Report. And we were talking with Fareed about Kardovite. And I really push the Kardovite dosage. I take a lot. I take 3 capsules twice a day. Sometimes I'll actually take more if I feel I need it. When you add it to our Supernox and our other things like Gamma E+, magnesium taurate, magnesium glycinate, fatty acids like Omega Supreme Krill, it's a fantastic product. It's really functional and basic for detoxification, improving your microcirculation, improving healing if you have a vascular event or if you're protecting your arteries. We use it with Vein Away to protect your small vessels, your eyes, varicose veins, spider nevi, the eyes in the back, the retina in the back of the eyes, as well as the glomeruli of your kidneys. And of course, the hawthorn, the source of hawthorn, which is one of the components of Kardovite, we're not using the berries. Tell us what we're using and why the research on that.
Well, a bit of a distinction. A lot of people think automatically that if you're using hawthorn, you're using the berries. And the research has actually shown that the active constituent, which is called vitexin, is more concentrated in the leaf of the flower. And so what we do is we use the extracts of the leaf and the flower, and we test for the active ingredient using high-pressure liquid chromatography. So it's present in a high amount. So the active ingredient is called vitexin. Right.
Now, vitexin, the thing about Kardovite is it's the only company that I know of that actually tests every batch for marker molecules in every single component, like vitexin. And the reason is you treat it like what I call nutrapharmaceutical, which is where we should really approach this. We have to have the right strain of organism, the plant. We have to have the right concentration in every batch so it's consistent like a drug, but it has biological effects that are not negative. So, for example, it causes remodeling of vessels. So if you've had probably part blockage or unstable plaque, it'll reverse it. We've had people that have had scheduled carotid artery or peripheral pudendal blood vessel surgery in their leg, and 6 months later, they don't need the surgery. We've had people who've had partial blockages and had maybe one stent put in, and the doctor is kind of watching to see if they're going to get worse, if they're going to put more stents or do a bypass. We put them on Kardovite and our other nutraceuticals, primarily Kardovite, and it goes away. That's pretty remarkable, isn't it? We literally see biovascular remodeling. We also see the protection against new plaque formation because it prevents that. It's not just the Hawthorne, it's the other components. So let's run through them and explain things like the ginkgo biloba, bilberry, which is an antioxidant to stop free radical nitric peroxy radical. These are all extremely important to stop things like heart failure, blood vessel spasm, unstable plaque formation, endothelial health of the small vessels, not only in your heart, but all your vessels of your body, your eye, your kidney. It's really important for people to understand. It's like the old story, if you don't take care of XYZ, it goes away, whether it's upkeep of your home, upkeep of your body, upkeep of your finances, upkeep of your world. If you keep on soiling the world, eventually the atmosphere will be destroyed enough, you won't be able to live outside. You'll have to live in a domed city. As I said before in other aspects of the show, human beings are soiling our cage, the world. We're soiling our bodies. We don't detoxify. When you take Kardovite, you start detoxifying heavy metals, bisphenol A, toxic chemicals that jam up oxidative metabolism in our mitochondria, CoQ10, carnitine, various forms like propionyl, L-carnitine, and it's really important to take Kardovite. And I tell people literally, don't wait until you get heart disease. Start taking in your 20s. I give it to my daughter with Down syndrome, and I think it's important to protect her now so she's 21 at 42, double her age, she's not on her way to heart disease. They did a study on children with Down syndrome that died traumatically in accidents, and they found in their 30s they had the same vascular disease as someone double their age. Even if they had no symptoms at all of chest pain, shortness of breath, or other problems, they were having unstable plaque because of the gene dosage. Well, my daughter gets all kinds of functional nutraceutical support, including things like omega cod liver liquid and many antioxidants. But an important component of that is Kardovite. So I think it's important people should start thinking, have I detoxified today? Well, the first step is Kardovite. So let's go through the components of why they're so important for your general health, your detoxification, your capillaries, your small vessels, and stopping unstable plaque, stopping hypoxia, which, by the way, promotes autoimmune disease and cancer. Cancer and autoimmune disease have a similar root, which is hypoxic acidotic tissue that grows stealth pathogens and doesn't get rid of heavy metals or volatile chemicals. Bad news. Messes up your DNA, messes up epigenetic control of your cells and tissues, makes cells angry, like what I call the angry patriot cell. Keep aggravating it, eventually it'll form a berm shelter and get nuclear weapons. That's what happens with a cell that's aggravated by toxic environment. It goes autoimmune and starts attacking other tissues in your immune system, or it goes rogue and becomes a cancer cell and turns on and off genes so you can't kill it. So then it multiplies as well. So if you start thinking of it that way, you kind of teleologically, you realize that, hey, Kardovite can save your life from not only heart disease, but also from dementia, glandular failure, autoimmune disease, and cancer. So it's a very important step toward wellness.
Yeah, and when Dad developed the formula, he really tried to make it a holistic formula. So that's why we have some of these other ingredients. So you mentioned detoxification, and when you're improving your circulation, you're also detoxing at a higher rate, and so Kardovite has milk thistle in it to support the liver, and
powerful stimulant for phase 2 detox. Right.
And the other component is the valerian root. People often ask, well, why is there valerian root in the Kardovite? And maybe you can go into that a little bit, Dr. Bill.
Well, the autonomic nervous system is out of balance, and valerian will balance it, because if you get excessive free radicals and stress basically causes everything. And the final common pathway is free radicals. So if you take valerian, you reduce your blood level of oxidative stress hormones from your adrenal glands, free radical oxidized fatty acids, all the things, basically the final common pathway of stress is from dysautonomia, autonomic imbalances. You'll notice people are much more calm. If they're taking Kardovite regularly, they say, I can cope with more, and I can function. I can do better without getting overwhelmed. I can do this kind of attitude. So, and then that comes from, by the way, stable biochemistry that makes stable brain chemistry that makes stable coping mechanisms. A lot of time when people are negative, it's because they are, quote, afraid they can't cope because they've proven it before, because their blood sugar, their stress hormones, their free radicals, their blood pressure, everything's going all over the place. Because they don't have adequate levels of magnesium, they got free radicals through the ceiling, they're developing unstable plaque, all their stress hormones are going crazy, thyroid, adrenal, they're dumping tons of adrenaline to counteract, other things going on in their system. And when you start taking Kardovite, you calm down. That's another thing. What other nutraceuticals are present in the formula?
Yeah, well, there's a couple things specific for microcirculation. So we've got the ginkgo biloba and the bilberry.
Yeah, bilberry is really important. It stops free radical damage, you call the transmembrane. Not only protects your eyes and skin, but all your brain and other tissues, because it's very dialyzable. And the bilberry and the use of bilberry is very important in pilots in World War I. They actually would use it at the end of the war to protect against ultraviolet light, because they didn't have glass with ultraviolet light blocking chemicals. The ginkgo biloba is very important for microcirculation. And ginkgo is going to open up the circulation in your brain, your heart, your kidneys, etc. So microcirculatory problems often precede organ damage and organ failure. Whether it's diabetic, or it's hypoxic due to age, or it's just circulatory problems because you've got very bad lipids and you're getting partial blockage, or microcirculation is kind of getting the shot. So that's where all of this kind of ties in. That's why I tell people, besides taking Kardovite, they need to take their omega fatty acids, omega supreme, omega supreme krill, omega cod liver liquid, all these kind of things. As I say, you live as well and as old as your capillaries. So anyone over 20 is a candidate for it, whether you're hypertensive or not, whether you're diabetic or not, whether you have any other health issues. You must detoxify, you must preserve your capillaries. You want your brain, your heart, your tissues. If you're an athlete and you don't want cramps, people take it and they stop having cramps, along with taking our magnesium and other products. You'll recover faster physically and emotionally to any stress you're on, and you just do better. It's a foundational formula. It's inexpensive, it's powerful, and taken with our other nutraceuticals, it'll stop you from getting hypertension and getting out of the toxic polypharmacy from the crazy drug-pushing doctors that will poison you and make your day miserable. Take Kardovite. Stay well.